Hey everybody, it's Leah Wise, also known as Crash Gal. I'm here with an amazing woman in our community. Her name is Valerie Rivera, and she is a trauma therapist. And we are going to be talking about mental health and the importance of seeking help when you need it. Hey everybody, welcome to episode 2 of Coffee with Crash Gal. This is Valerie Rivera. She is a trauma therapist, and I really admire the work that she does for our community. Part of my platform is wanting to spread awareness about mental health. Full disclosure, I have seen a therapist. I have gone through trauma therapy, and it honestly did wonders for me. So I wanted to sit down with Valerie today and talk a little bit about what trauma therapy is. So I'm gonna let her introduce herself. Go ahead.
Yeah, hi everyone. So my name is Valerie Rivera, and I'm a licensed clinical social worker in the state of Texas. I currently work full-time at UTRGV School of Medicine, where I provide therapy services to the medical students, and recently opened my private practice, Inner Solace Therapy, going on a year, so I'm really excited about expanding that.
That's awesome, congratulations. But you've been doing trauma work, you said, for about 5 years now.
About 5 years now, yes.
Okay, so trauma is a very broad word, right? It can mean a lot of different things. What is trauma, and what are the different types of trauma?
Trauma has a variety of different aspects, right? And there are 3 different types of traumas that we can really categorize them. One of them is acute, and acute is known as simple, although I'm not a fan of that term because I don't think there's any simple trauma.
Right.
But basically what that means is that it's a one-time occurrence, right? So whether it was a car accident that impacted you a certain way, that's your trauma, but you've never endured any other type of trauma, right? It could be as severe as a rape, one-time occurrence. And so that's the acute part of it. The next part is chronic. Chronic trauma is when somebody endures multiple.
Ongoing.
Ongoing, yeah. It's severe, it's multiple different types of traumas, right? Various. So you were in a car accident, then let's just say illness, rape, just various types, right?
Different types.
Yeah. So that's chronic, right? Now, there's also something called complex trauma. And what that means is that, again, it's multiple and various types of traumas. But the caveat to that is that it's usually, for example, childhood abuse. Usually it's the person, the perpetrator that has done some of those things, is from a family, family dynamic.
Somebody that they trusted.
Yes, exactly. That's the key word right there. Somebody that they trusted, whether it was a family member or a caretaker, a caregiver of some sort, and usually in childhood. So again, they could have experienced, that childhood abuse, sexual abuse, physical abuse, emotional abuse, but the perpetrator was somebody that they knew and somebody that they really trusted.
So, this is a very hard conversation. This is not something that, that you take lightly or that, your colleagues take lightly. What are can you give us examples of what your patients have been through? I know that there are confidentiality rules, so you can't go into too much depth, but I want people to get a better understanding of maybe things that they've experienced and they think that's not trauma. Yeah. You know what I mean? When it really was. They're downplaying their trauma. So can you, give us some more examples of what the trauma that they've been through?
It's not about the heavier trauma, but it goes from car accidents all the way to terroristic attacks, domestic violence, childhood abuse. The majority of my clients that I see have experienced childhood abuse, and because it was earlier on in their life, what happens is that they develop these maladaptive behaviors, right?
What does that mean?
Maladaptive meaning that I'm going to do something to protect myself at the time. And so at the time, what I always tell my clients is that, because when they grow up, and they become these, functioning adults, they start to notice that behaviors that they had in the past are no longer serving them a purpose. And so an example would be this. Maybe as a child, you were being sexually abused, and so you no longer want to connect with people on a very personal or physical level, right? Hugs, kisses, touch is difficult for them. Right. So then what happens when they avoid, right? But what happens when you want to be in a relationship And then that's difficult, right? I've had clients that experience a lot of triggering effects from certain touches, right? And for them, it's confusing because they say, I've been with my partner for so many years, and then all of a sudden they touch me a certain way, and they've touched me that way forever, and now I'm like,
triggered.
And so they don't understand that.
Right.
So what happens is the cycle of guilt and shame and embarrassment starts to perpetuate, in their day-to-day life. So my job with them is to help them understand, right, that the behaviors they created as children had a purpose, and that purpose was for them to find out, was it to protect, was it to avoid further harm or damage? And then realizing that that behavior is no longer serving a purpose because you no longer feel threatened by people,
Right.
But it's hard for them to do, like, to understand what they went through and place it in their current day.
So I mentioned EMDR. EMDR is a type of trauma therapy, correct? Can you tell us what EMDR stands for and what it is?
Yeah, so EMDR is a tongue twister. It's eye movement desensitization and reprocessing. Okay, and so I'm going to break it down a little bit, right? Because there's a lot of wording there. So eye movement meaning what we call bilateral, right?
Okay.
The eye movement is a back and forth, where the eyes will, the therapist will guide the client to use their eyes back and forth. And the reason for that is because we're trying to connect certain things in the brain. And what we know about the brain is that there's emotional parts of the brain, memory parts of the brain, and cognitive parts of the brain, right, that we're all trying to integrate, okay? So that's what that part does. The desensitization is exactly what it says. We're trying to desensitize any triggers from past in the current moment, right? And the reprocessing is what's really important about trauma. The reprocessing is really about making sure that when you think back to that memory, it no longer has the same triggering effects. It no longer has the same impact, right? So you're reprocessing the memory to understand that, again, what happened to me back then is no longer happening to me now, right? Yeah.
So I did EMDR, and I truly feel like it saved my life. And when I've talked about it on social media, I get messages from people saying, what is that? I want to know more about that. I went through this, I went through that, I want to get better. And then the few people who have experienced EMDR therapy, they'll message me and say, I'm so glad you're shedding light on EMDR because it's so important and it's not super well known. How many certified EMDR practitioners are there here in South Texas?
Yeah, so what I am aware of right now is that there are about 5 or less certified EMDR therapists. And so we can have EMDR trained therapists. What trained and certified means is that certified, they went through a longer, not necessarily a longer training, but longer supervision with somebody that is certified and even has certification to, consult with us. Okay, so it's more consultation hours. And for me, that was very, very beneficial and helpful because, and up until this day, I still have a consultant. I've been certified for, a year now, and I still have a consultant because it's just important to continue to make sure, right, that I am still learning for the benefit of my clients.
So we live in the Rio Grande Valley. We are predominantly Latino community. Have you found that there is a lot of shame in the Latino community surrounding mental health and getting the help that you need? And if so, what advice can you give for Latinos who are struggling with that?
Yeah, I've worked with a lot of clients that come to me and say, my parents don't know that I'm in therapy. I talk to my parents or grandparents or caregivers about what I'm experiencing, and a lot of it is dismissed. A lot of the times, because our parents, grandparents grew up in a different, time, different culture, they feel maybe isolated and alone with their own thoughts, their own type of mental health. And so what we talk a lot about during that time is establishing boundaries. You know, your parents may be able to provide you with certain things in life, but maybe they're not the people that are ready to support you, you know, through your mental health journey. And we have to learn how to navigate that. You know, how painful is it for you to feel like you can't go to them for that specific thing, especially when we're feeling really down and out, you know, about who we are as a person. So, you know, I've seen that part of it, but then I've also seen other parts where parents will actually call me and say, hey, you know, my kid is an adult, but they need help. And you know, and that's amazing. Yeah. I'm like, all right, well, let's do this, you know, because what better person to be rooting for you, you know, be in your corner than the people that you believe, that you love and that you care for, you know? And it doesn't always have to be parents or grandparents. It could just be, you know, that one person that has taken care of you, that has rooted for you your entire life. So
awesome. I love that we are seeing a trend towards more acceptance of seeking mental health. So we can talk about therapy, self-care, you know, trauma work all day long, but the reality is it's just not very accessible to a lot of people who, you know, are low income earners, you know? And I've had, you know, some of my followers reach out to me and say, hey, I see you've talked about EMDR and therapy. I don't have health insurance. I'm not making a ton of money right now. What can I do to seek help? And I'm at a loss for words because I don't know. Is there any recommendations you have for those people?
Yes, absolutely. You know, I think therapy has this, not stigma associated with it. Well, yes, stigma associated with mental health, but this idea that therapy is not necessarily accessible, right? And so I'm going to kind of trump that a little bit because in the community, we do have resources. What doesn't help is that those resources aren't necessarily talked about as much, right? And so within, you know, local community, whether you're here in the RGV or anywhere else, you can always reach out to your church, you know, your church or any other church in the area. Most of them will have a therapist, you know, on hand. And if they don't, they'll be able to refer you somewhere. Okay, so that's one thing. The other thing is we have different clinics in the area, right? So like here in the RGV, we have Hope Family Medical Center. And
Hope Family Medical Center.
Yes,
okay.
They're located in McAllen. They provide therapy. They have great therapists. You know, I've worked with some of them before, and they're just amazing at what they do. And they have a sliding scale. You know, they have reduced fees, so they will be able to help you seek, you know, or get connected with a therapist. There are other online platforms as well. You know, one of them is called openpath.com. You go on there and you pretty much let them know what you can pay, and then they'll connect you with a therapist that will be able to provide you with a therapy based off of those fees. So there are so many different, you know, community resources and online resources that, you know, of course, I'm willing to share. If anybody needs, you know, a therapist, I can definitely help do that.
So for potential clients who maybe want to reach out to you and hire you or, you know, ask about resources, where can they find you?
So I have a website, www.innersolacetherapy.com. And then, you know, my Instagram and my Facebook panhandle is @InnerSolaceTherapy.
And if you just want like mental health tips and, you know, videos and stuff like that, her Instagram is a great resource. There's a lot of great resources on Instagram, believe it or not. I actually came across Valerie because I reached out to Coffee with Counselors, and I asked them, you know, I wanted to sit down with a trauma therapist, and they pointed me in Valerie's direction. So thank you, Lisa and Alex of Coffee with Counselors, for making this connection. But I love that on social media, it's becoming more okay to talk about mental health, and that it's okay to seek help, you know, whereas before there was a lot of shame, and there still is a lot of shame. And so part of what I'm doing with, you know, my platform is talking about, hey, I've done it. It helped me. It worked for me. Let me try and connect you with somebody who can help you. So I just want to thank you so much for sitting down with us today. This is such an important topic. Feel free to reach out to Valerie if you need a trauma therapist. We will also include the resources and websites that she provided for people who maybe can't afford a therapist. And then, of course, if you ever have questions about my experience with EMDR and therapy, you can always send me a private message. So thank you so much, Valerie. It means so much to us that you joined us today and that you opened up about what it is that you do.
Yes, thank you for using your platform for all things mental health. I think it's important for everybody to understand, the importance of mental health and how it impacts your day-to-day functionality. So yeah, I appreciate the opportunity. Thank you.
Yes, of course. Well, thank you guys for tuning in. It was a great time, and we'll see you in the next episode.